Hello, I'm Hannah. I'm going to be your nurse today. So your doctor has given me an order. I know that this is Mary Smith, but your doctor has given me an order to change your central line dressing. It's been 4 days, so we're going to go ahead and get that changed for you, okay? So I want to verify that I have the right patient. I've been seeing Mary all day, but I want to be sure. So her armband says Mary Smith, 5/18/1963, and that matches my MAR. But I'm going to ask and verify that she can verify that as well, and she does. I'm going to ask, Mary, do you have any allergies or any sensitivities to anything that I might use to cleanse your skin or any of the tape or dressings? She says none to the dressing or the cleanser. She does have an allergy to morphine, which is noted on the MAR. Okay. Mary, I'm going to go ahead and get my supplies ready, and then we can discuss any questions you might have. So I have my central line dressing kit. I also have I have an alcohol wipe and a skin prep, just in case those are not included or if I need more. And I also have some tape. So I have my supplies. I'm going to talk to Mary about this procedure, make sure she understands what it is, and that she understands why I'm doing this. Especially if she has more vulnerable skin, she's going to want to know why I'm pulling off this really sticky tape, and just understand why that needs to stay in. In Mary's case, she still needs a couple more rounds of antibiotics, and her physician still thinks that that is a necessary intervention, having that central line. So I have my little piece of tape here. This little piece of tape, if I can get it off of here, is just going to be to label. Oh my goodness. Well, I can do that at the end. I'm not going to waste time with that right now. That is going to be, I'm going to get a piece of tape to label my central line dressing. Okay, I'm going to wash my hands, and I'm going to sterilely open my central line dressing kit. I'm going to open this without touching the inside. Now inside I have a mask, which I am going to place on myself. And then I'm going to explain to Mary that this is a sterile procedure, and if she is able, I'd like her to wear a mask as well. If she is not compliant or does not understand or is just not able to have this mask over her face, I could ask her to turn her face, or I could have a CNA or someone else help me to hold up a drape or a truck or something. Okay, now that I have put my mask on, I'm going to re-wash my hands. And Mary has said that she will wear the mask. Okay. So I'm going to remove my sterile, I'm not yet to my sterile gloves. I'm just going to lay those there. I'm going to apply just clean gloves because I'm going to be removing the actual dressing. Now, while removing this dressing, I want to assess underneath. I want to make sure that there is no redness. As I'm touching it, I want to make sure there's no tenderness. Mary says there is no tenderness. And as I'm removing it, I'm going to want to look for any kind of drainage, ecchymosis, and edema. Now, this is kind of hard with gloves. I could use my alcohol wipe to loosen that up as I go. Now, while I'm removing this, I want to be pulling towards my insertion site, not away from it. Now that I have that, Now, of course, this would be sutured to the body, so not pull. And I want to avoid touching that insertion site as well. I'm going to look at my dressing and make sure that, to look for any drainage, the amount, the color, consistency, and note all that. There is no drainage on this dressing. Okay. Now, I have assessed my dressing is okay. I'm going to remove my gloves. I'm going to wash my hands. Now I am going to open my sterile gloves. Touching only the outermost portion. Okay. I'm going to pick up my gloves. Pick it up, keeping my thumb abducted. Okay. Now, I have in my sterile kit, I have my alcohol swabs to cleanse. Make sure that I have everything I need first. Okay. And I opened these from the wrong side, but that is okay. They're still sterile. Okay. I'm going to remove one at a time. Starting closest to the insertion site, I'm going to move around, going in an outermost and an outer more fashion. In there, I'm going to come around. And I would be tossing these in the trash. All right. Now in my kit, I also have a tong and a chlorhexidine scrub. I would squeeze these together to engage the cleanser. Now with this, I'm going to be applying friction to really cleanse this area. Now I can use my tongs to lift. Oh, well, like I said, that would be sutured in, so that would not pull out like that. I would pull up, and I'm gonna scrub, applying friction. Now I am still sterile because I have not touched anything. I have not broken my sterile field. Okay, and I can lay that down. Put that in my trash. All right, now that I have cleansed my site, I am going to allow that to dry. I could also use a skin prep, going around in a square around the site to prevent skin irritation and skin breakdown where I have this dressing. I'm going to let that completely dry because I don't want anything wet underneath my dressing that could cause irritation and skin breakdown. Okay. So on this dressing, I also have my tape wouldn't come away, so I have this little piece. I could use this to mark my dressing. Okay. Garbage. Okay. So what I want to do is I want to cover some of these lumens. Okay, so cover my lumens. I'm going to try to eliminate as much air in there as I can. Oh, my dressing. Okay, well, think on your feet, right? So, looks like my dressing, maybe it got too warm or something. It's not wanting to fully come away from the dressing. So, in clinical practice, I would remove this. I would start and I would get a new dressing. And I want this nice and flush with the skin. I don't want any air pockets or bubbles. Oh, there we go. Like I said, I would remove that. Okay. I'm going to remove my sterile gloves. Remove those. I have my my sticker here. I'm gonna put my initials and the date on here that I applied this. I would apply this on the outside. Now I could use this piece of tape to further anchor these 3 lumens here so that they're really nicely protected, and I'm not allowing anything to enter that since this central line goes straight into the heart. Okay, so then to finish my skill, I'm also going to change out the caps on my lumens. I would flush those with normal saline, and that is routine every time you do a dressing change. Those are sterile. I could also use the impregnated caps on those as well. At this time, I can wash my hands. I can remove my mask. I can have Mary remove her mask. I can ask Mary if she has any questions. She says she does not. She said the procedure went well. There was no discomfort and no complaints. So I would make sure that Mary is in a safe position. She has her call light. I have marked my sticker there, and then I'm gonna, after I clean up my supplies, I'm gonna go document the time and date. I'm going to document if there was any drainage, what that looked like, what the site looked like, as well as that I've changed the caps, and if there was any change. So if I noticed that there the central line was pulled out any further, I could also measure to see how far out it had come and any changes that I notice around the insertion site. Okay, that's my skill.